Hello, I am Kevin Anderson.
And I'm Adam Okada.
And we are clinical educators and hosts of the Ask the Educator podcast, brought to you by Healthmark, a Getting a company.
Are you a sterile processing technician, infection preventionist, or biomedical engineer? No matter your role, if you're involved in medical device processing, this podcast is for you. Our goal is to equip you with the knowledge and tools for excellence in medical device processing.
Now let's get started. Hey everyone, welcome back to the Ask the Educator podcast. This is Kevin Anderson, your host, and with me as co-host, Adam Okada. And for this episode, we have our very own packaging princess, Malinda Elammari, joining us. We are talking all about functionality testing in this one. So if you've not heard of that, hopefully you'll stay tuned and learn a little bit more about it. This is a very important part of what we do, or what we hope that you do in your department every day. So Malinda, what are some examples of functionality testing of instrumentation that people should know about?
So some examples would be the obvious ones, right? Like scissor testing, making sure that your scissors are sharp each time. And that testing should be done each time the instruments come through to sterile processing. It's not just, oh, okay, once a month kind of thing for the scissors. Um, and making sure that, while we're talking about that and you have the two different types of material for testing. So it's not a one size fits all concept. If your scissors are 4.5 inches or larger, it goes to the red or, the thicker material, whatever color that thicker material is for you. If it is lot smaller than that, it's gonna go to the yellow material, or the thinner material, and that's because those materials are imitating tissue, so it imitates what the surgeon's gonna cut, and you wanna make sure that you are making 2 to 3 cuts in that material, and it's smooth like butter. You don't wanna snag or pulls, nice smooth cut, and you wanna use the distal 3/4 of that scissor when you're making those cuts. So, red would be something like Mayo or Met scissors, and then yellow would be something like your Tanotomies or your Iris scissors, those smaller ones. So, I think scissor testing, also the big one, insulation testing, right? Like, I feel like we've talked that one so much, and facilities have gotten so much better with insulation testing. But when it comes to insulation testing, there is one that we kind of miss out on, and that's more so the like bipolar forceps, monopolar forceps. Here's a good one: leap instruments, right? Nobody really thinks about those and testing those and whether those should be tested, and they have to be as well. Um, I'm gonna say also testing to make sure that your needle holder is gonna hold a needle. That's another testing, that functionality testing, and the ratchet on your instruments, the actual clamp that locks. So that's called the ratchet. I think too, as I go into facilities, I see, staff, they have the best intentions of they think they're checking things, but they don't really understand the why behind it or the know-how of testing those instruments. And so they're missing pieces, key parts to it. And I think too, we've got to get back to the basics. And that's one of the reasons that I love that we're doing this one, this podcast right now about this, is because it seems like such a basic concept, but it gets missed in so many facilities. Um, you know, Knowing the anatomy of your instruments. What is a finger ring? What is a shank? You know, you, like, again, I remember shank because it's the long part of the instrument, and I need that if I go to prison. I have to shank somebody. I need something, right? Like, that's what I would want with me. Um, your
Well,
box lock, your
I think something that you touched on that is really important that I want to circle back to real quick is the why. So you brought up scissor testing as your first example. And I want to stop there because we have talked about insulation testing and the why. So circling back to the scissor test, and I know, Melinda, that you worked in the operating room, and that's where the why comes full circle. I mean, if your scissor is snagging your test material, essentially, you know that it's also going to be snagging this delicate patient tissue and also possibly producing more bleeding or uncontrolled bleeding or trauma to the tissue, and that's why it's so important. And another one that we were sort of discussing beforehand was lubrication of instrumentation, and that's one that you could also speak to, right? And then you know uh, what was the other one? Oh, leap instruments. That's
Yeah.
another one that gets missed often when it comes to insulation testing, but we use leap uh, instruments for cauterization or laser cauterization or whatever, and there's a number of different reasons that those instruments could, because they're in constant contact with the tissue, they could end up being a conduit for burns, unintentional burns. But what are some other ones where we could explain the why behind them? You mentioned the shank or I'm sorry, the box lock.
Yeah.
Uh,
So
uh,
the ratchet testing,
yeah.
so I was kind of referring to that one. And we look at the ratchet and people are like, oh, well, what's the big deal? But if, let's say, for instance, and to your point, Kevin, that's really where it comes full circle is when that surgeon is down deep in a cavity and they're trying to suture a bleeder or they're trying to put together an anastomosis of something, and let's just say I'm going to use the heart surgery, for instance. It's the only conduit they have. They had to take leg vein from a patient. It's the only good conduit they have. And they're down there trying to suture that last conduit. And for instance, your scissors aren't cutting right and they wind up cutting the vein wrong. And now you mess up the conduit. They have to shorten it. And then eventually it becomes too short, and that becomes a problem. But the ratchet, let's say I'm down there with the needle holder and I'm trying to suture something, to or close something, and that needle holder keeps springing open on me and it drops the needle every time. Sometimes the surgeons are way down deep in these weird, odd spaces, that it's not just a straight, hey, I'm on the skin kind of suturing, and they drop a needle. It's hard for them to find it, get it back, and start suturing again. So ratchet's extremely important. Lubrication, to your point, again, I'm down there suturing and now like me having to spread my fingers so hard and so wide to open that needle holder because it's stuck and it's not functioning smoothly is going to take longer time. It's going to possibly cause issues for the patient, and the procedure. And, instrument milk it so, it's important that we're milking the instruments. I think another thing too that we kind of fail to realize is that instrument milk, when you put it on, so it should be applied after washing, right? So in assembly side, that's where you should apply your instrument milk. And the reason for that is because you want to spray your instrument with it or get that milk into the box lock, work it in, but you don't want to wash that off afterwards. You just damp the excess off and you sterilize it like that because the combination between the instrument milk and the steam process helps rebuild the passivation layer on your instruments as well. So it's a twofold, right? You're lubricating that instrument, but you're also helping to build that extremely important protective layer on that instrument. So, yeah.
Yeah, no, I think those are great points, and this is kind of a forgotten piece of
Mhm.
education, right? We we always train the techs that, oh, hey, you're supposed to test these instruments for functionality. We train them that way. But if they don't really understand how they're used in the OR, why it's important that you test a kerosene because of the damage that it can be done if it's not taking that biopsy correctly in the case. So, like, the how the surgeon uses it is a very important part of that education, and we should be sending our techs up to observe surgery so that we can test things like that. But one thing that I wanted to ask you about was monopolar cords and bipolar cords. Like, these are often forgotten as far as functionality testing is concerned, but why should we be testing things like monopolars and bipolars?
Yeah. So, great question. So, as far as monopolar and bipolar cords, They're used in conjunction with electrocautery, right? So they're hooked up to what's called a Bovie up in the operating room, a Bovie box. And so that what winds up happening is, let's say you don't, let's just take the current, for instance. You don't have current running from one end to the other the way it should. The surgeon will sit there and tell the circulator to amp up the level of, uh, electricity going to the pencil that they're burning with or the forceps or something. And then, if there's any little nick in that cord, you get sparks and, that winds up causing fires in the operating room. So it's important when it comes to those cords that you're not just testing you're not just looking at the insulation, but you're also testing it for insulation damage. And then you're also testing that the continuity is flowing from one end to the other. So those are major key points. In addition, just, FYI, if you are using reusable monopolar and bipolar cords, a lot of them have a use life. And so you're supposed to be tracking that use life and replacing them after so many uses. And that is something that we don't see happen very often out there in the industry.
Yeah, I'm so glad that you mentioned that because that is something that we learned the hard way back when I worked in the operating room. I actually witnessed these monopolar cords. We were doing a laparoscopic gallbladder removal, and the doc was just cauterizing away, and the monopolar cord sparked and severed right by his hand, and
Mm,
it was one of those experiences you never forget, and you realize after the fact, like, there was a lot going on here that coulda like, number 1, it could have been resulted in a fire, it could have resulted in a injury to the patient or the doctor. There's a number of things that coulda happened, but then you look at it and you're like, "Well, why did that happen?" Well, we weren't doing any sort of continuity tests. We didn't know about them back then. Plus, I worked in the OR, so I didn't really know all the sterile processing related stuff back then. And then what we ended up finding out in the IFU was that there were limitations on how many times those were to be processed. Now, that particular vendor was in the IFU, it said at least 100 uses, but I have seen other IFUs where it says like 25,
mm,
and so there's a wide variety there that people need to be aware of. So it's the continuity testing component in addition to insulation testing of the cord, plus looking at the IFU and tracking the amount of the times that it's been reprocessed and reused. Those are huge components. And another one that I want you to speak to, if you don't mind, I didn't put it on our notes here, but it is the magnetism. The
yeah.
magnetism of these needle drivers, especially in these, microvascular cases. I mean, that's a big deal, and that
Get
people
out of
need to
my
know why
head.
that matters,
Yeah.
right?
Get out of my head, Kevin. I was just going to talk about that. Like, Um, so yeah, testing for your instruments for magnetization. So many times, I guess like when I was in sterile processing, the deal was like if you had a vascular tray, they would just take the whole vascular tray and just demagnetize it, right? And there was
Mm,
no real test. And so, trying to figure out a way to test it and make sure that your instruments are demagnetized. Um, and then making sure that, they're functioning for the surgeon, right? So again, in vascular cases, some of the needles that we use are the size of your eyelash and sometimes even smaller for eye procedures, right? And the sutures, like for an ADO, it's like a spider web. It's so thin and small. And so you can imagine how tiny those needles are. And so if you're going to take a bite with that needle holder and that needle, and then you go to release it and it sticks to the needle and you can't get it off, and the surgeon's under a microscope, or the other hand's already holding a pinched vessel or something that they're trying to suture. You can imagine the frustration in that level, right? Like, and the danger to the patient. So
mhm,
making sure that we are, ultimately, whatever we're doing, the functionality of these instruments is to make sure the patients are safe and that the surgeries go smoothly as possible, right? Um, checking to make sure that the pieces are there, like all the pieces are there, they're not cracked or broken. And this is one of the reasons that I really emphasize when I go into facilities and do audits and try to do education and stuff like that, as well as I'm, auditing, but, asking questions like, what does gold mean? Like, it's not just, okay, functionality, but understanding what are your instruments, and what do they mean? What does black handle mean for your scissors? And a lot of people, they might know the answer of like, hey, oh, gold means tungsten carbide, and then my next question is that's like, fantastic. Now show me where is the tungsten carbide on your scissor. And a lot of people think it's the gold part that's the tungsten carbide. And I'm like,
Mhm.
nope. So explaining to them, because when they're inspecting that instrument, their eyes should go to where that tungsten carbide insert is. We start seeing separation on the scissors. We start seeing pitting right there where that insert lies, and so your eyes should be trained. Hey, gold, somewhere on here is tungsten carbide. My eyes should go straight to that point. So it's a lot of, I think, again, back to the basics, right? What do black scissors mean? Why is blue titanium more important? Why do surgeons want supercuts? What are supercut scissors, right? And that's just basically that one of the blade is a TP and the other is a D shape. And, when it cuts, it slices like a guillotine, cut your head straight off, right? It's not a gnawing action. So, like, your other scissors. And so this is why it's really important in vascular procedures and stuff. So,
Yeah, we've gotten into shanks and guillotines. I mean, I feel like this is a true Malinda Elammari podcast here. But I want to share a story real quick because functionality testing, it is very important. We obviously we need to check to make sure that things are clean in that inspection step, but also that they're functional in the case. So we had an issue in one of our hospitals where the tech did not pre-assemble the chest spreader, and it was an emergency
mhm.
ER chest spreader. And when they went to go use it, the little twist handle piece for the chest spreader did not fit the spreader that was there. And so they
Oh,
had to
no.
call us with an emergency situation. I need a chest spreader that's functional, sterile right now because we are opening this patient up in the ER
Yeah.
to do like an emergency case. And that was a huge deal. So we had this big testing and education and all these kind of things to show them why it's so important. And the ER actually came and said, this is what we use this for. It's an emergency case
Hmm.
that we need to do something right there. And it really was a big education for the staff to understand that the things that we do in sterile processing have an effect with the patient. So functionality testing is a huge part of this. So I just kind of wanted to share that story and throw that in there. But Melinda, do you have any final thoughts for the listeners before we end the episode?
No, I mean that to your point, Adam, that's a great example. It's not just functionality of, oh, is this sharp and that stuff, but it's also functionality of being assembled. I was in a facility where the concept, those retractors, chest retractors, were constantly being put on backwards and
Mm.
misarranged. So I literally took a doll, a stuffed doll, and did surgery on it in like for education and showed them how the retractor spreads the chest open and stuff like that, so they can understand the way it needs to be put together.
Yeah.
So I think for me, my final words out there is to any manager, educator listening to this podcast right now, or and even end users, know why you're doing something, right? Look at the inner parts of it and understand how it's functioning. There's, and I get not everybody can go to the operating room to watch a procedure if you're not in that position to be able to do so. Look it up online. Like, when you get a free time, just say, oh, I want to see how does this, Wheatlander work. I want to see how does, this Gelpy work. Um, and just understand the whys behind what we do. And if you're an educator, teach the whys behind what we do. Learn them and teach them to our staff. So once people learn that, it ingrains in their brain. Oh, look at that. Ingrains in your brain. Okay. Anyway, so it ingrains in their brain. And then, when they're taught something wrong, it's gonna be a trigger, right? Like, they're like, "No, wait, that doesn't make sense to me. So I think that's my encouragement is, and know that it's just not back in the days where we just had to do, oh, like, let's look at a forceps to make sure that there's a tooth there, there's more to it. Um, oh, and before I forget, scopes, testing your scopes. It's not just holding your scope up to the light and looking in through the light. That does not show you that the image is going to be correct and stuff like that. And if you don't have a device that really helps you inspect that scope the way the surgeon's gonna see on the operating room. There are other ways to do it, holding it a quarter of an inch away from an image that is not, um, like that's a matte image, and making sure you're checking the shaft of that scope, that it's not bent or damaged, checking the light fibers in that scope by holding it up to the light and looking for, a complete white circle or, crescent or whatever at the distal tip. So there's different ways to do it, but you gotta know the whys behind what you're doing.
That's the perfect way to end, I think, is to understand and encourage our listeners, whether they're leaders of the department or maybe their frontline staff, is to get curious and learn about why we're supposed to be doing these things, as well as the how, and to pass those things along so that you don't have people like me who tend to not do things if you don't understand why. So let's save everybody from the young Kevins out there, and get them acquainted to the whys and encourage them to be curious about their functionality testing of instruments and make our patients safer. All right, thank you so much, Melinda, for joining us, and
Mhm.
Adam, as always, for co-hosting. What's up? You got something else for everybody? Hmm?
Me? I don't know.
Okay, okay. I
Well,
thought you were trying to
I
say something.
was gonna just say, you can always reach out to your educators, right? We're
Yes.
always here. So, Adam, Kevin, myself, any of the health mark educators, if you have a question, we're
Yeah.
we're we're here to help you. We're here to
Yeah,
help
because we would
explain.
go on forever. We could talk
Exactly, we
forever, but
could.
then the podcast would get boring and all that. So, but if
Hey, wait
there's
a second.
something that
Not
comes to
boring.
your mind after listening, you can always reach out to us. And actually, that's a reminder for me to plug our little email address that I forget about sometimes. So, if you do have a question, you can reach out at asktheeducator@hmark.com. That's our email address if you have further questions about this. Thank you all for listening. All opinions expressed on this episode are those of the presenters. This podcast is for informational purposes only.
For using any medical device, it's important to review the manufacturer's instructions for use and consult with a professional.
For any questions or feedback, please reach out to us at asktheeducator@hmark.com.